Are they prone to hip dysplasia? Hip dysplasia is a common skeletal condition that can affect humans as well as animals, including dogs. This article aims to explore whether certain breeds of dogs are more prone to hip dysplasia than others. Specifically, we will focus on the factors that contribute to the development of hip dysplasia in dogs, the breeds that are commonly affected, and how this condition can be prevented or managed. Hip dysplasia occurs when the ball and socket joint of the hip fail to develop properly. This can result in a loose or unstable joint, leading to abnormal wear and tear of the hip. Over time, this can cause pain, lameness, and the development of arthritis in the affected joint. Although genetics play a significant role in the development of hip dysplasia, environmental factors such as excessive growth, poor nutrition, and lack of exercise can also contribute to its occurrence. Certain breeds of dogs are known to be more prone to hip dysplasia than others. Large and giant breed dogs, such as the German Shepherd, Labrador Retriever, Golden Retriever, and Rottweiler, are commonly affected. This is believed to be partially due to their genetics, as these breeds have a higher incidence of the genes associated with hip dysplasia. Additionally, their size and weight put added stress on their joints, increasing the likelihood of developing this condition. However, it is important to note that small and medium-sized dog breeds can also be affected by hip dysplasia. Breeds such as the French Bulldog, Pug, and Dachshund have been known to have a predisposition to this condition. In these cases, genetics and other underlying factors still play a role, but the smaller size of these breeds means that the impact on the joints may not be as significant compared to larger breeds. Prevention and management of hip dysplasia in dogs primarily involve a combination of genetic selection, nutrition, and exercise management. Responsible breeders should conduct hip evaluations on their breeding dogs to reduce the risk of passing on the genes associated with hip dysplasia. Screening methods such as the Orthopedic Foundation for Animals (OFA) evaluations and pen hip evaluations can help identify dogs with healthy hips for breeding purposes. Proper nutrition is crucial in the prevention of hip dysplasia. Feeding a balanced diet that is appropriate for the dog's age, size, and breed can promote healthy bone and joint development. Overfeeding or rapid growth in puppies should be avoided, as it can put additional stress on the developing joints. Consulting with a veterinarian to determine the best diet for a dog's specific needs is recommended. Exercise management is another important aspect of preventing hip dysplasia in dogs. While regular exercise is essential for overall health and well-being, excessive high-impact activities or repetitive movements can increase the risk of joint damage. Encouraging low-impact activities such as swimming or controlled walks can help maintain muscle strength and joint stability without putting excessive strain on the hips. If a dog is diagnosed with hip dysplasia, there are various treatment options available depending on the severity of the condition. Non-surgical management may include weight management, exercise modification, and the use of supplements or medications to alleviate pain and reduce inflammation. In more severe cases, surgical interventions such as total hip replacement or femoral head ostectomy may be necessary to improve the dog's quality of life. In conclusion, hip dysplasia can affect dogs of all sizes and breeds, but certain breeds are more prone to this condition. Genetics, size, and weight play significant roles in the development of hip dysplasia, but environmental factors such as nutrition and exercise management also contribute. Responsible breeding practices, proper nutrition, and exercise moderation are important measures to prevent hip dysplasia in dogs. Early detection and appropriate treatment can help manage the condition and improve the dog's quality of life.